My name's Amy Hanson, and I've been training in CranioSacral for about 9 years. I tell people I do medical treatment voodoo because it's really hard to explain. Our focus is on the connective tissue rather than bones or muscles itself, but everything is wrapped in connective tissue. We're like Costco's of connective tissue. And so we find that, everything is so wrapped. If you think of Costco, like maybe the muffin trays are moving, but the real problem is that over the toothbrush boxes have been crushed over, so that working on the muffin trays isn't going to help until you fix the toothbrush boxes. And it's so random and fun, and you just kind of go in and you see what's moving, see what's not moving. That tells you where to start. We don't always know why we're working on someone's left foot, but we just trust that the person's body knows what's going on and knows how to heal. There are sort of 3 layers to the work. There's this sort of just straight up mechanical work on the connective tissue. One aspect of it is that there's connective tissue around your spine and around your brain, and it also dives down and separates right and left sides of your brain, and then also separates upper and lower brain. So something in your tailbone, you injure your tailbone, and you can get headaches from that because there's a pull now, and it just pulls till it finds the weakest link. So it's really interesting and fun. As you train more in it, it gets weird, which is really fun. The bodies can store trauma. We call them energy cysts, but it's just some random chaos that the body shrinks down and encapsulates. And if we work on connective tissue, we can often get things to a point where the energy can release. We can find them, and we just let them unwind the way they want to unwind. That's pretty fun. My husband, who's videotaping, was in a bike accident recently, and one night he asked me to work on his leg, and he had just all kinds of energy releasing from his leg, and then his leg was fine. Felt better. So, and then the next layer of weird is that we can monitor the rhythms of the body, and it'll tell us when the brain is speaking or when the body is speaking. So if someone comes in with pain, like knee pain, we can talk to the knee and find out, like, okay, what's going on? And it's always talking to the knee, always talking to the pain. We may go in crazy fun places, but it's always focused on the pain and what the body wants you to know. And so it's just a lot of fun. So yeah, that's the medical treatment voodoo. And my wow story is that I have this sort of distant cousin who lives in the rough area, and she has a son who has a genetic condition. And her mom nagged her to have him come see me, which was great because I worked on his tailbone for I worked on him no more than half an hour. His tailbone for maybe 15 minutes, and worked on his legs for 15 minutes. He wanted no part of this, really. And I found out that one of his character traits is he perseverates. He'll fixate on one thing. Like his grandmother said that when they visited, he would fixate on when they were going home, and he'd have his bags by the front door, and he would talk about when are we going home, constantly. Or if they were in the car, he'd fixate on where are we going, and just constant loops of where are we going, where are we going, where are we going, and just working on his tailbone that little bit. He stopped doing it that weekend, which was amazing. So that's my wow story. Wow.
You really treated the parent. You gave parents a great treatment.
Yeah, exactly. Yeah. What's that?